Good morning. My name is Dr. Joseph Zelk. I'm a sleep specialist out of Portland, Oregon. Been practicing for a few years, shy of 20 years in sleep disorders. Been focusing mostly on home sleep diagnostics, obstructive sleep apnea, and oral appliance therapy. I hold a few patents in oral appliances and have a couple of FDA approved and PDEC approved mandibular advancement devices, and I'm a real big fan of oral appliances. And I wanted to say a couple words on things I like to add to oral appliances to make them work better. And one of them specifically I found recently is called the Snooor body positioner or body trainer. It's called Snoor. Dr. Rick Downs is the North American distributor, and I've had the pleasure of being able to utilize this with my patients. And I believe this is a step forward in improving the objective assessment of oral appliance responses. In the field, it is well known that patients respond extremely well subjectively to oral appliances, but getting that objective data collection on how well is their apnea hypopnea score treated, and along with the snoring and how they're feeling as the oxygen levels fully optimized in sleep. Does the patient have well-treated sleep apnea, both in REM and body positionally related sleep apnea? Because oftentimes oral appliances do fantastically well, but leave a little bit left over untreated on the back that needs to apply either a little small positive pressure, which I've been doing with, say, the Bongo RX, little nasal inserts that apply a little valve for expiratory positive area pressure, as well as opening the nostrils and supporting the nasal valve. But in this case, I think the Snooor is a fantastic option. It's very affordable. It can be obtained by the consumer. So a consumer can buy it. I don't have to write a prescription for it. And unlike some of the other body positioners out there, they can be up to 5 to 10 times more expensive, more bulky. I'm really thinking that the Snooor is going to help us elucidate and illuminate how patients are really sleeping. Are they really sleeping well on their sides, or do they end up on their back unknowingly? So in my case, I'm really encouraging all my brand new oral appliance patients who are going through the gradual adjustment of the jaw coming forward to get that airway support. I'm recommending that they do some sort of objective monitoring, like a high resolution pulse oximeter ring, like the Circle ring, which gives me an oxygen desaturation index, as well as a hypnogram, sleep graph, as well as the Snooor. You just paste it on the chest and it'll stay in place. It's really small. It's literally, yay big. Has a little watch battery that lasts for a very long time, and a really excellent interface with the app, so you can see body positions throughout the night. So I'm really giving it a big endorsement, and I really encourage all of those out there experienced with oral appliance therapy to give more visibility to us sleep specialists, so we can see how the patient's responding, both in overall body positional therapy, and of course adding small and reliable consumer-based products can really help us out, because that way the patient can take the initiative, start the process, and we can be there to help them, guide them on their learning curve when they're trying to deal with their obstructive sleep apnea and snoring. Well, thanks so much, and look forward to talking to you soon on any other questions regarding sleep.